The city of Agogo in the center of Ghana. John Amawasi and his research team are making their third visit to the home of Teresa Sarpong and her family. The reason? Her daughter Michelle had acute diarrhea a few weeks ago. I was really afraid for her. She was so weak, and small children can die from diarrhea. Michelle had caught a highly infectious parasitic disease known as cryptosporidiosis. John Amawasi has been researching it with his team for some time now, and they want to find out exactly how it is transmitted. That's why they've been visiting the patients in their homes.
They get worried because they think that, well, they must have a very strange and very serious disease. This is why people have come all the way from town in white coats and wearing gloves to take their blood or to ask them questions. And then the risk of that is, apart from they being worried and anxious, then people can stigmatize them. So this is the guy who brought the people from town, or this is the guy for which the people came all the way from town to take his blood and ask a lot of questions. He must have serious issues. Maybe we need to avoid him.
The diagnosis of cryptosporidiosis was confirmed at the local hospital. It is regarded as a neglected tropical disease, and many cases have been diagnosed. Buruli ulcer patients are treated in another room. It's an infectious disease of the skin. How it is contracted is still unknown. It is another example of the so-called neglected tropical diseases. The patients here are lucky that the hospital is participating in a research project. That is why they are treated free of charge.
The focus really is on our patients, the people who are neglected. These are the poorest of the poor who cannot afford medicines. That is, if the medicines even exist, they cannot access them. So it is really the people who are neglected.
1 hour away in Ghana's second biggest city, Kumasi. John Amawasi heads the African Research Network for Neglected Tropical Diseases. The network's goal is to provide policy procedures to improve treatment of rare diseases, or even better, to completely eradicate them. Amawasi also lobbies for funding for the costly research to convince African governments and the super-rich to become more involved. After all, his samples still must be sent to Europe because they lack the necessary equipment at home.
Extracting DNA from crypto is...
The very frustrating thing is when you have the ability to do something and you don't have the tools to be able to do it. It's a very frustrating thing. I know how that feels. When you know you can save a life, when you know you can make a difference, but you just don't have the tool to be able to execute the work that you want to do. And a lot of people train in Europe and North America, come back to several African countries, and they end up going back because after a few months of work, they realize that, look, I'm not able to do what I was trained to do. I cannot offer my best service here, and they end up going back.
John Amawasi says heading back to the U.S. where he studied is completely out of the question. Even though he is now often flying around the world for the network, he enjoys his rare visits to his country. He wants to be able to help people like Michelle, and his vision is clear, a continent free of tropical diseases.